Hello, I am Dr. William Richardson. I'm a medical doctor and director of the American Clinics for Preventive Medicine. Today I want to talk to you about our chelation therapy program, that's C-H-E-L-A-T-I-O-N, chelation. Our chelation therapy program is basically given in the same way that the American College for the Advancement of Medicine protocol dictates. It is a treatment that is used to rid the body of heavy metals such as lead, cadmium, arsenic, aluminum, and such. These heavy metals are saturating our environment through polluted foods, air, water, etc., and certain specific pollutants such as cigarette smoke and toxic waste. So when these heavy metals get into our bodies, they get into our cells and decrease the efficiency of the cellular mechanisms that make energy, so they can be associated with chronic fatigue. These metals can also be associated with hardening of the arteries by way of accelerating the formation of hardening of the arteries and oxidation of the membranes that line our arteries. The word chelation actually comes from the Greek name that means claw or chele. And basically this chelation process pulls or claws out heavy metals out of the body, and it excretes them through the urine, the feces, and the skin. Oftentimes we measure a 12 or 24-hour urine collection to see what metals actually come out of one particular patient. The process has been used for decades. It was first used in World War II to pull heavy metal toxins that were used as war poisons or chemical warfare out of bodies. Then it was used to detox sailors who were cleaning ships that were infected with the lead when cleaning the ships. So they were getting sick, and oftentimes these sailors would have heart disease, and voila, we found out that the chelation process also appeared to help cardiovascular disease. Well, this has been borne out by numerous studies, mostly through the members and doctors of the American College for the Advancement of Medicine, but lately in the Journal of the American Medical Association, a study has been completed which did show benefit to patients who have had a previous MI. The chelation therapy process uses primarily a man-made amino acid called EDTA, or ethylene diamine tetraacetic acid. So this is added to a solution of sterile water. The dosage is calculated strictly depending on the lean body weight, whether a person is male or female, and the kidney function of the person. Great lengths are done to protect the kidneys and other organs during this process. The bag also, that is the IV bag that's infused, also has vitamin C, B vitamins, and magnesium. And the chelating agent, the EDTA, bonds with the magnesium and actually shoots magnesium into the cells that surround the arteries, which are depleted as we age, and it pulls in exchange, it pulls out the calcium out of the arteries, thereby decreasing hardening of the arteries. It's also been shown to actually aid in building up bone, so it does not pull calcium from the bone. This process takes 3 to 3.5 hours to do, and it's done in the physician's office. There's very little discomfort. Possible side effects include the discomfort from a needle. A small catheter is inserted into the arm. It is highly recommended that people are well hydrated and fed, because adding extra fluid to the blood can decrease the blood sugar. So one has to make sure that they are well fed when they have chelation and well hydrated. Along with the chelation process, we perform lifestyle counseling and a great abundance of educational materials, videos, DVDs are given to help the patient get their lifestyle in congruence with a lifestyle that will aid the body in ridding itself of the heavy metals with the aid of the chelation process. So this chelation therapy has been shown to be advantageous to folks who have heart disease, high blood pressure, hardening of the arteries. It's preventive in cancer because the metals, these toxic metals, can promote cancer in the body. So ridding them is very beneficial. Also for neurodegenerative diseases such as ALS, Parkinson's, and Alzheimer's, these treatments can and have great benefit to patients. So we want to invite you to study further this process of chelation therapy and invite you to our clinic for an appointment to discuss these matters further. Thank you for listening. This is Dr. William Richardson.